Hi, I'm Lance Parker, Senior Advisor and Coordinator at the University of Texas Health Science Center. And joining me today is Dr. Willis, Dr. Tori Tucker, and Ms. Donna Walker. I'd like to begin by thanking each of our participants today. The Lunch and Learn series intends to provide engaging conversations and meaningful information to support the professional growth of students, trainees, and stakeholders. What I want our viewers to take away from today's conversation is to define health equity, identify strategies to overcome health disparities, recognize the importance of health policy, and improve outcomes in minority communities. Dr. Willis, I'd like to start off with you with the first question. The first question is, how might health equity improve outcomes in minority communities?
Well, let me just begin, Lance, by just saying thank you for hosting this conversation. I think it's important, with this month being Black History Month and having a topic of improving the health status of minority communities. I think it is really fitting for us to have this conversation and say thank you to my colleagues, Dr. Tori Tucker, Ms. Donna Walker from our nursing division, Dr. Tucker in research. I think you brought together a good panel, with different perspectives. But when we talk about, what health equity is and what that means in minority communities, I think we first need to just remind the listeners about what health equity is. And health equity is defined as the absence of unfair or avoidable differences in health among populations that might be defined socially, economically, demographically, or geographically, according to the World Health Organization. And so health equity means taking away barriers that might exist that prevent people from being able to access the services that they need when it comes to health and medicine and even with prevention. So I think when we talk about specifically minority communities and health equity, we need to be looking for innovative strategies for collaboration, strategies to build trust and confidence in our health systems. And I think more than that, to also train health professionals, medicine, nursing, pharmacy, you name it, public health, to train our professionals to be able to work effectively with diverse populations and people that come from a lot of different walks of life. So I hope that kind of answers that question.
Does anybody else want to add to what Dr. Willis just said?
Yes, this is Donna. And again, thank you for me to be on this panel. And as from a nursing perspective, we are to be the patient's advocate. So in being that advocate, again, meeting them where they are, expressing empathy, and then building strong partnerships of trust. So when we relay information, it will be accurate and they will take that into consideration.
Dr. Tucker, do you want to add anything?
Okay, yes, I definitely did. I do want to just once again thank you for inviting me to this very important talk. One of the things I look at with health equity is also making sure that the things that are available to other communities are also available to the community to which you belong. I do believe that unfortunately so many people in these circumstances believe that there are things out there that are available that they just don't have access to. And sometimes they really believe that that's due to their interactions with their healthcare provider. And so that's where that trust sort of comes in. And so I do believe that, in our community specifically, they need to feel that this particular healthcare provider or wherever they go, they have these talks, that this person has their interest in mind and that they're going to value them the same way they value anyone else.
Awesome. Okay, Dr. Tucker, I'd like to ask you the next question. The next question is, incarceration and mental health issues are prevalent in minority communities. What are some steps that can change that narrative?
Well, I think that's one of the, unfortunately, is one of the things we sort of see on the news every day. Unfortunately, as the states go and everyone starts to have to balance their budget and they start cutting budget, unfortunately, when they decide that they want to cut budget, mental health sort of is one of the first things that gets targeted. And so when you start cutting mental health, what you're then doing is allowing someone maybe outside of the mental health field that have to start intervening in some of these crisis situations. So I just really think that one of the things we have to do is just really reestablish the need and importance of mental health and understand that in some cases, in most cases, when we have incarceration and things like that, it's simply because we're really probably putting people in the wrong place. If someone is having a mental crisis or some type of crisis, and you simply decide to bring in your law enforcement instead of maybe social services, that's one of those things I believe that compounds the problem. I'm not saying that's the only issue, but I do believe that as we start restricting resources and now you have people sort of acting out of their post, and now when you're trying to bring law enforcement into mental health, I believe that's sometimes a problem.
Wow. Dr. Willis, do you want to add anything to that?
Yeah, absolutely. I think Dr. Tucker makes a really good point. And speaking about the interrelationship between mental health issues and then the incarceration topic. And I'll tell you, Lance, that one of the most modifiable social determinants of health is education. And so I think along the lines of what Dr. Tucker is saying, we have to educate professionals more about, what are some of the best approaches to intervene, even in a situation where we're working with budget landscapes that are really not the best for the time or the situation, but we have to come up with innovative approaches that would allow people to receive the support or the assistance that they need from the most appropriate professional. Because I think law enforcement, as well as the judicial system, they play an important societal role, but they can't be strapped with the burden of dealing with things that are not in their area of expertise.
Amazing. Ms. Walker, do you want to add anything?
Yes, I think that minorities are highlighted, but of course they are not the only ones represented in the incarceration and mental health issues. So when we're talking about students and trainees, really taking the holistic approach and not just a label of mental health, but of total well-being, encompassing all aspects of care.
Yeah, and I think, Lance, if I can just jump right back in before you get to the next question, what Ms. Walker says, about the holistic approach and really the advocacy within the nursing kind of perspective, it really reminds me that, for the benefit of our graduate students, our professional trainees, and even stakeholders throughout our campus community and the broader community, I think we have to become more comfortable with or proficient in collaborating across disciplines. Because some situations don't fit into the nice box of one discipline. It requires a multidisciplinary approach, and you have to have a team of providers who have different areas and levels of expertise, as well as access to different resources based on the credentials that they have. And so, I'm really kind of excited that we're having this conversation, because it's making me think, a little bit deeper about some of the things that we can do as a campus community of our own to kind of promote, some collaboration and interdisciplinary type of work throughout the community to make sure that people are aware of and understand how to access the assistance that's available.
Awesome. Okay, Ms. Donna, my next question would be to you. What are the steps minority communities can take to overcome health disparities?
Okay, and health disparities and oppression, I think, as it's already been spoke a little bit about with Dr. Willis and Dr. Tucker, is the education. I believe it all begins with education, basic education, but then health literacy, which is a whole different language that we need to be fluent in. Higher education, of course, is associated with a longer life. So I think just those pillars and building upon that within our communities, again, being the advocate, building these strong partnerships and collaborations will help to overcome some of these opportunities for improvement.
Dr. Tucker, would you like to add to that?
I believe that you sort of covered this topic very well. I just think that in most cases, we just have to spend a little bit more time looking at it and understanding that everyone has maybe a little something that they're working on. And I just think that if we could maybe not be a little, how to best say this, sometimes there's stigmas associated with requiring certain types of help and certain types of intervention. And I do believe that if we can make an attempt to sort of normalize utilizing resources that other communities utilize on a daily basis, that if we can get around some of those issues, I'm thinking that that's really probably the first hurdle that we need to overcome to actually start to address some of these questions.
Dr. Willis, you have anything to add?
Yeah, I agree 100% with, the recommendations and sentiments of Ms. Walker and Dr. Tucker. And I would say that really to sum up the things that they've said, we really need to use a health equity lens. When we're working in the community or we're speaking about trying to reach out to some of the underserved populations or groups that are not traditionally accessing healthcare at the rates that they need to, I think we need to really use a health equity lens, in the development of interventions or development of outreach programs, whether they be clinical outreach programs or educational type of outreach programs. We have to come in understanding that there's a history of injustice in some ways when it comes to access to different services and resources, and knowing that, take an approach that works to build trust, works to bridge maybe the communication divide or the understanding divide between providers and potential patients. And I was happy to hear Ms. Walker talk about, health literacy. I mean, and that's a big thing. And health literacy is different than basic educational literacy, because there's a totally different language being spoken in healthcare. And if a person shows up, an individual shows up to an appointment and everything that's being said is over their head and they don't understand it and they don't feel like they have an advocate, then we're missing that opportunity to build that important trust that's so vital to a person's care.
Amazing, Dr. Willis. Amazing. You guys are doing amazing right now. The information that you guys are giving is really helping me as well. My next question is to you, Dr. Willis. What is the role of social determinants of health in minority communities?
Yeah, so I mean, social determinants of health are those non-medical factors that affect a person's health outcomes, are especially significant to minority communities, but significant and important to every community. I mean, your zip code has just as much or more to say about your health outcomes than your genetic code. I mean, now Dr. Tucker might push back on this in just a second. The expert in biological sciences here, but where you live and kind of your ability to access healthy choices is important. I mean, if you live in a proximity to a grocery store that's providing healthy food, a walking trail that encourages and allows you to get out and exercise, I mean, you're really at a disadvantage if you don't have adequate access to these type of non-medical determinants of health or social determinants. And next to that, I mean, there's also an employment slant. There's also a social slant of engagement and involvement, feeling like you belong. And so I think we just have to do our best to create circumstances or situations where community leaders understand how important it is in the planning process to think about the health of neighborhoods whenever you're doing infrastructure projects, as well as community building or community engagement type of work.
Dr. Tucker, do you want to give some pushback, as Dr. Willis said?
Well, first, I agree wholeheartedly with everything that Dr. Willis just said. But the one thing I did want to note is just to echo that point. I mean, so we've all heard of a term called food deserts. And so I think one of the things that we really have to start addressing, as Dr. Willis was talking about, the lack of availability of healthy choices. When you go to certain aspects, maybe not Tyler proper, but in other areas. And so you have a large number of people, but maybe there are no grocery stores, but they're nothing but convenience stores. Okay, needless to say, I don't believe that people are going to go to your convenience store to get apples and oranges. Okay, and so that sort of just echoes Dr. Willis's point that that's one of the things that happens, when you have that lack of healthy choices. The other thing I do believe is just as far as community interaction, and once again, it just goes back to trust. I believe that most communities, they have to have someone that they can trust to really break things down. So for instance, with my mom goes to the doctor and the doctor tells her something and she comes back and she says, well, I really just didn't understand what they were saying. And so she can maybe explain it to me and I can try to explain it to her, tell her to go back and get a better understanding. But what happens with someone if there's no one in close proximity to that person or in their community or within their sphere of influence that can provide that information? So now all of a sudden, just simply because this person's group, okay, just their sphere of influence, just because they don't have a member that can maybe answer some of these more pertinent questions, now they're all of a sudden at a disadvantage. So I do believe that that's one of the things that happens. And so, of course, with all of the members of my family and my friends, if they choose to ask me, I mean, they can ask me or I can find someone that can answer that question for them. But I believe that's one of those things that also sort of plays a role, is you want to have people around you that can help answer these questions that unfortunately maybe you didn't have answered appropriately while you were in front of your care provider. So I think that that's a large determinant as well.
Ms. Walker, do you want to add on?
Just a little bit. So much has been already spoken about, but the thing about the vital conditions, as Dr. Willis was talking about, I was listening to the Healthy People 2030, and Dr. Adams, the U.S. Surgeon General, was talking about, again, housing, transportation, but again, as influencers and as leaders, not just going to the community, but being a part of the community. As Dr. Tucker explained, there are many people in the community that know me and that I've been a nurse for years, so they feel confident in asking me questions. And again, in a non-judgmental way, trying to meet them at the level to where they can understand, and it's a mutual benefit, because if there's a lack of understanding, there's also a lack of compliance.
My final question is to you, Dr. Tucker. What policy changes can help improve the health status of minority communities?
Well, one of the main policy changes that I would really envision, I've actually spoken with Dr. Willis about this before, is I call it like intentional diversity. I do believe that there's one thing that we can say that we want to encourage diversity in our healthcare community versus saying that we're going to be proactive about addressing these problems. One of the things is, as Ms. Walker stated, sometimes people feel more comfortable just simply dealing with someone who maybe understands their circumstances or their situation better. Okay, and so if I feel like, okay, this particular doctor that I'm visiting also happens to go to my church, or he happens to be in my community, there's a little bit more of a connection and now maybe a little bit more trust. So that when I go speak to this doctor is a little bit more familiar with my circumstances. And so therefore I may be a little bit more honest. I would improve my adherence to those doctor's orders. But my personal belief is that if you really want to increase or improve these issues, is maybe increase or improve your representation. So that now when you go to your care providers, those care providers actually represent the communities that they're treating. And I believe that's probably one of the largest hurdles to clear.
Ms. Walker, do you want to add?
I was talking when you posed the question about the political healthcare policies. Again, from a nursing perspective, we are to be a part of organizations. So being a part of the Texas Nurses Association, American Nurses Association, you have these political action committees that are more representative and there's power in numbers. And I was just thinking about, again, in our population where there's so much marketing to adolescents, for instance, for tobacco use and being involved in policies that increase the age for tobacco sales, but being involved uh, from your community to your local, your state, and then your national levels. Because if we're not involved and we're not representative and we're not knowledgeable, then we would lose our effectiveness in these healthcare policy changes.
Dr. Willis, would you like to add?
Yeah, no, I agree 100% with Ms. Walker and Dr. Tucker's recommendations when it comes to policies. And I would add that, you know, it would be helpful, I think, from a policy standpoint, if we could encourage more decision-making groups to invest in prevention and to invest in education. You know, we have a much better chance of being able to improve population health or health in the public whenever we can implement broader interventions that allow people to adopt healthy lifestyles and healthier approaches. And obviously, we can't just make a recommendation to folks without giving them some training on how to do it and showing them, you know, exactly where that can be done. You know, the example that Dr. Tucker provides about, you know, choosing fruit from a convenience store, you know, or a grocery store. People are going to the grocery store to get there. You don't traditionally say, oh, I'm gonna go get a bag of apples from a convenience store. And I get it. You can maybe find some that would have it, but generally we're trying to change people's way of thinking and help them create healthy lifestyle choices. And so we really have to have these whole community approaches, like Ms. Walker spoke about earlier, that really allows individuals across the board, regardless of who they are and what they look like, to have equitable access to opportunity to improve their own lives. And I think when we empower people with education about how they can do it themselves, as well as access to resources that are equitable, then we're giving our whole community more control over the future. And I think ultimately that's what we want to do. We want to be able to improve health in general, but specifically close the gaps for those underrepresented or underserved groups that may have largely been left out or are fallen victim to diminishing trust in our systems of public health and healthcare.
In closing, I want to thank Dr. Willis, Dr. Tucker, and Ms. Walker for participating today in such a important conversation. I'd like to wrap things up by reading a brief biography of 3 African-American figures who made major impacts on the field of health, medicine, and research. The first person is Annabelle Samuel Thomas, was a nurse who co-founded the National Association of Colored Graduate Nurses. She fought for equal employment opportunities for African American in the American Red Cross and U.S. Army Nurse Corps, and U.S. and was one of the first nurses to be inducted into the American Nurses Association Hall of Fame for her work with civil rights and Black feminism activism. The next person is Charles R. Drew from 1904 to 1950. Charles R. Drew was a surgeon and a medical researcher that studied blood transfusion, and blood banking. He also developed a method to preserve blood plasma for transfusions that saved countless lives during World War II due to the development of large-scale blood banks. He was the director of the first African Red Cross blood bank and was protested against racial segregation and the donation of blood. The last is Mary Beatrice Davidson Kenner, was an inventor who holds more patents than any other Black woman in history. She is best known for inventing the sanitary pad for menstruation. However, it took 30 years for her invention to be developed and manufactured for mainstream markets due to racial mainstream discrimination and sexism. Thank you for you guys for participating. Thank you, Dr. Willis. Thank you, Dr. Tucker. And thank you, Ms. Walker.
Thank you, Lance. I appreciate the opportunity.